This is the small tweaks, big payout, big result. And if this is not in your budget, there's also other ways that you can do it. I have videos on how to start a good skincare routine. We sort of have to pick on you a little bit and we have to say, these are the things that you're bothered by, and these are other things that we notice. This is really not the treatment for you. You might think it is, but I'll let you know if it is or isn't. Hi everyone, Prem board certified facial plastic surgeon here. I'm gonna talk to you today about something maybe a little controversial. It's small tweaks that have a big result. And remember, like, subscribe, and follow if you like this type of content. So in my office, I see lots of different people. I see lots of different patients. And remember, I'm not gonna make you look bizarre. I'm not gonna make you look weird. I'm gonna cut you off if I think there are procedures that are making you look wacky. But I do think that with the right combination, we can make a very nice transformative result without making you look weird, without stretching your mouth, or even giving anyone the idea that something's been done. We're gonna use a great example, a patient of mine that I've treated in my own office with both non-surgical and surgical options. And she's been treated by two nurses, one that works for me and another one that I work closely with. So let's get into it. Again, this is the small tweaks, big payout, big result, and it is not bizarre looking. It's not gonna look funny. It's not gonna look done. Let's start with the first thing. So here's the patient. Now, the things that sort of bother her are minimal to most people, but you might notice them and maybe you might not notice them. Certain things are like dark under eye circles, skin texture irregularities, a double chin, fullness in the face and fullness in the cheeks. All of these things might seem minor to you, and they are. And so as plastic surgeons or aesthetic providers, we really have to get into the nitty gritty here. We sort of have to pick on you a little bit and we have to say, these are the things that you're bothered by, and these are other things that we notice that might make your result a little bit better. And so the first thing that I did for her was I did some neck liposuction. So neck liposuction in the right patient can be done in the office, local anesthesia, takes about 30 minutes to do it. It's a 5 or 6 days of downtime. You can get back to most activities. And in the right patient, and I say that because it's age dependent, can really sculpt and tighten the neck. It's really not for everyone. It's specifically for patients with a small bit of submental or double chin fat here and a little bit along the jawline. If you find yourself having laxity or you're in an older age group, this is really not the treatment for you. You might think it is, but I'll let you know if it is or isn't. But that is a very big payout for a small tweak because again, small downtime, you don't even need to have anesthesia for it. The biggest benefit that I think you can see in this patient is with her skin. She's got hyperpigmentation, acne scars, uneven skin tone and texture. And after a combination of good medical grade skincare, in-office treatments like lasers and resurfacing peels, she has an incredible outcome. She's not gonna look different. She just has more even skin tone. And for someone who's in her 20s, she's not looking to come in every single month or spend thousands and thousands of dollars for the rest of her life to get her skin to look a little bit better, and neither should you. But if you have a particular concern, the dream costs what it costs, right? You're not gonna go into a dealership and ask for Mercedes, but ask for Honda pricing. Things just don't work that way. But if you want a particular result, it is going to take a certain amount of techniques to get you there. So for her, it was consistent use of antioxidants, retinoids, sunscreen, and pigment suppressors to brighten the skin, and then lasers like CO2 laser resurfacing and chemical peel specific for her skin type and her skin tone. So that was the other main thing. The last piece of this is filler. Now I know everybody's scared of filler. I want to remind you, filler is not scary. It never was, and it doesn't need to be. I know there's fear mongering around it because people are worried that filler is not going to dissolve. It's just going to disperse. But filler in the right person in small quantities, not done over and over, can look really nice. So we did some filler in her lips, which is why she looks bruised in that first picture. Filler on her chin and in her jawline to soften some of those shadows and just balance the rest of her face. And then of course she did some GLP-1 medications to lose some weight. So all these together have really given her a more balanced look. And so that's why I think focusing on the skin and small things like submental liposuction or upper eyelid blepharoplasty can make a dramatic result when you look at your before and afters, but I can almost guarantee that no one's gonna know when they look at you that these treatments have been done. These are very much small tweaks, big results. And if this is not in your budget, there's also other ways that you can do it. I have videos on how to start a good skincare routine and these types of things where you're just getting started and it might be where you want to go in the beginning. So the other thing that we did for her, which is a little hard to detect because I am so particular about what we use under the eyes, but it's a combination of PRF Easy Gel, which is growth factors from your own blood, as well as Exosomes, under the eyes. This can soften the skin as well as brighten the under eyes and help with texture and pigmentation. Now, I would say maybe 5 years ago, we didn't really have a lot of tools to help with genetic hyperpigmentation under the eyes or darkening under the eyes and crepiness other than lasers. But now growth factors have really come a long way. And when they're injected in the right plane with the right frequency, it can make a pretty dramatic impact. So even though this isn't super obvious, this was done and it really just overall brightens the face quite a bit. I also use the regular liquid PRF under the eyes. In this case, Nurse Jasmine, my nurse in my office, did an incredible job with the under eyes. So if you like this type of content and you like this type of treatment and learning more about it, like, subscribe, follow for more, and I'll see you next time.